fire. But let me tell you how this became personal last couple months. This is Philomena. That's my mom. Thank God we named my sister Diane. Now, Diane did call me a couple months ago. Mom was facing a serious medical condition. Now, she has COPD. I joke that the tar from the cigarettes keeps her joints together. Little CHF, and she's fallen a couple times. So, I get the emergency call, come down to Florida. Basically, Mom's going to have surgery or face certain paralysis from the neck down. So, for 2 weeks, I spent in a hospital room, and I've been in healthcare for 25 years. And I wrote in my hospital impact blog a few weeks ago, you don't know jack about patient experience until you've been in the hospital room with my mom 10 to 12 hours a day, facing this surgery, which could have killed her. And so we spent 2 weeks with the neurosurgeon and the pulmonologist. You know, we're warning you, blah, blah, blah. But my mom's a trooper. She's a real trooper. She wanted to have it. She wanted to have a quality of life. And of course, she defied all the odds, which is typical of her. But let me tell you how I compartmentalized my experience. I came down to this, and people ask me, well, tell us about the experience. Neurosurgeon, followed to the ends of the earth. He mechanically fixed my mother. All the limbs were working. This is a mere, 90 years old in September, by the way. Okay? This is great. Hospital experience. Good and bad. But there's one telling moment that unfortunately, and I'm educated, I still compartmentalized. My sister and I leave the room one time to, just a much-needed break. Somebody from finance comes in to collect my mother's Medicare copayment, as my mother is contemplating her death at this possible operation. Well, you know what? Hospital, no. Neurosurgeon, yes. And that's how I walked away from the experience. And I work in healthcare. So really, let's start taking a look at why we need a chief experience officer and maybe the role in healthcare. First of all, we're marketing something nobody wants, right? We don't issue the daily Groupon, buy one stent, get one free today at the Cleveland Clinic, right? What happens is we inundate the public with all these kinds of messages. We're great. Here's our scores here. Here's our this there. At the same time, much to the, by the way, the disinterest of most of the public. At the same time, people are leaving your organizations with a bullhorn. And they're talking about the experience. And it's been documented, even your loyalists will talk more about the bad experiences than the good experiences. So again, delayed purchase over time. All these expectations are building up in your head so that when somebody comes into the door, the expectation that they had and the promise better meet the care. And so if I was looking for the first role of a chief experience officer, I would look at that. Chief Promise Keeper. Yesterday in the social media sessions, Jeff Roars said something, set an expectation and do not hit it, and you're really going to be in trouble. And when I look at some possible roles in this, I really look at a bigger tie from experience management and marketing. You know, a lot of times we look at how we surface patient testimonials in the organization. A lot of times it's happenstance. I think when you're controlling it from a culture that looks at experience, those types of things are going to happen more naturally. When you hire navigators, you hire them for their clinical experience, you hire them in silos. Do you have the consistency of the experience? And I do a lot of work in long-term care, and what's happening is that now your accountable care organization is extending out into long-term care and rehab, and then with telemonitoring, you're going into the home, and so the whole healthcare equation is getting blurred. You need a chief experience officer to look at all that.